Welcome back on this Monday. Let's talk about hair loss.
Yes.
It affects over 80 million Americans, but there are safe and effective ways to treat, even prevent hair loss from happening.
And joining us now to talk about it is board-certified dermatologist Dr. David Banasali. Thank you for joining us.
Thank you for having me.
All right, let's jump right in and talk about what does normal hair loss look like, and when can you tell there's an actual medical issue that's the problem?
Sure. So you might not believe me, but it's actually normal to lose up to 100 hairs per day. I know a lot of times you see it on your couch or on your pillow and you might freak out a bit, but that's completely normal. If it's, let's say you're having some localized itching or maybe some like systemic symptoms like weight loss or cold intolerance or things like that, then there could be other reasons why you're losing your hair.
So let me ask you something. At what point, so 100 seems like a lot, right? And so that could probably worry somebody. But at what point do you say, hey, this is something more than just a normal amount, I should go see a doctor?
Sure. And I agree. 100 is a lot. It's one of those things you probably don't notice how many you do lose.
Yeah.
But usually I tell my patients, honestly, look, you kind of know when something is up. If you start noticing these clumps in the shower or clumps, again, on your pillow, usually I have my patients just come in, or I tell them, look, like it's much easier to maintain hair than it is to regrow hair. So sometimes it's better to be safe and have a trained professional take a look.
Okay, so what are some of the causes of this hair loss that you see people experiencing?
Sure. So I like to kind of break it down, internal versus external. So internal, you could have nutritional deficiencies like low vitamin D or ferritin. You can have thyroid issues. You can have other issues like, we actually see this quite commonly if you give birth, right? This postpartum hair loss, which is very common. Post-COVID, we've seen a ton of it. I'm sure you've seen a lot of the articles trending that people are losing their hair, even TikToks. And even just baseline stress. I've seen people coming in with hair loss after a bad breakup, after losing a job, or even losing a loved one. So, outside of the obvious genetic reasons you can have hair loss, there's a lot of other factors. So again, it's one of those things where it's worth kind of looking through the entire history and trying to determine what the exact reason is.
I'll tell you, I went through a divorce, and that was the time. I remember it well. I remember it was coming out in clumps on the floor, and I went to the doctor, and they said it's stress. And I said, how can stress cause this? But it really does play. It plays a role. So, is there anything in particular that does really put people at risk for hair loss outside of that?
So, and your story, unfortunately, is very common. And I say this somewhat tongue-in-cheek, but it's never the eyes. It's always the hair is the window to the soul.
Yeah.
And, a lot of times with this, obviously there's genetic reasons, right? If mom and dad or your grandparents have lost a lot of hair, it's probably a good idea to be a bit proactive. Again, some of these nutritional deficiencies and a lot of darker skin types, we see low vitamin D or low ferritin. So especially in our female patients as well, where that plays a large role in a lot of how we tackle the hair loss. So I always start with a baseline set of labs with our patients, make sure, again, we're isolating the internal causes versus the external causes, and we go from there.
Okay, so doctor, is there a way to kind of prevent this from happening?
Sure. This is actually becoming a lot more common. We're seeing a lot more patients coming in to kind of establish that baseline. What that means is, look, you should be coming in anyway for your yearly skin check to make sure there's no skin cancers, but we have our patients, we take photos of their scalp somewhat professionally in our medical way, and then we can objectively look every time they come in, whether it's once a year, once every 6 months, and just see if there's any progression. If there is a slight progression, you might want to do over-the-counter treatments or something very conservative. If it's looking like it's moving pretty quickly, then we look at more professional options and prescription options for our patients.
Well, so what are some of the at-home treatments that people can try on their own before they move to professional?
Sure. So the most common ones, obviously, are the over-the-counter minoxidil, FDA approved. It definitely works. It's just really hard. I always tell my patients, look, I get it. It's like watching paint dry. You apply it every night and you don't really see the results immediately. It takes about 3 to 4 months. And so it does work, though. And so I usually have my patients put it next to their toothbrush at night, and then we hope for the best. But, the laser caps, too, they're a bit more expensive. Admittedly, the literature is iffy on those. Do I think they help? Probably. How much they help, that's a bit, still out for discussion, if you will. So I tell our patients, again, if you want to start the minoxidil as a preventative thing, it's not a bad idea, and it probably will help long term.
Now, doctor, are there any concerns if you stop these at-home treatment? Will you see more hair loss or kind of stunt the growth?
Sure. So that's a good common misconception. Usually what I tell patients is this. The minoxidil, all these things help grow your hair. But the hair is on a trajectory to fall out, right? And so you think of it as you're going down a hill and they're putting brakes on this hair loss and maybe even reversing this car up the hill. If you remove the brakes, then it's going to start falling out like it normally would otherwise. And so you don't really lose hair from the treatments, but you'll go back to kind of where you were or perhaps where you would have eventually ended up.
Okay. What about professional treatments? What can you expect from those, or what's available?
Sure. So there's a lot of really interesting breakthroughs that are in process or coming soon, and I'm very encouraged by them. So obviously the minoxidil and the oral finasteride are the FDA-approved treatments. In dermatology, we have a lot of off-label treatments, so that means they're not quote-unquote FDA-approved, but they might have indications in other therapeutic areas. So, topical finasteride is becoming more common for males, topical spironolactone, or even oral spironolactone, which is a medication we use for acne and even blood pressure. We're seeing, obviously, I think you may have seen the trending oral minoxidil, which is off-label, but it's the oral version of the topical that we use very commonly. You have to worry about side effects like blood pressure dropping, you can have some swelling, and rarely some cardiac issues, so you should always see your dermatologist. And now we're seeing a lot more compounded options as well. One of the projects that we started was actually something called Hair Stem Labs, which essentially allows doctors to access a lot of these compounded medications, but usually that has to be through the dermatologist. They have to choose what is appropriate for their patients. And finally, we have hair transplants, which in the right patient can be life-changing, but you have to make sure that's really the only option when you get there. And I always tell patients there's a lot of steps you can take before you get there.
All right. Well, Dr. Banasali, thank you so much for joining us today. We appreciate it.
Thank you so much for having me.
Nice to see you.